All right, in other news, the Federal Capital Territory Administration has confirmed the outbreak of 8 cases of diphtheria are claiming a 4-year-old's life in the Abuja suburb of Dede. Joining us now to discuss the outbreak in Nigeria and efforts by the government to curb the contagion is Dr. Austin Ajogwu, Incident Manager, Diphtheria Department of Federal Ministry of Health. Dr. Ajogwu, it's good to have you with us. Can you explain the seriousness of this outbreak of diphtheria currently?
Good afternoon for having me. I want to correct one impression. We have not confirmed 8. We only confirmed 1 case of diphtheria in FCT. It's only 1 that we've confirmed, and other suspected cases, about 30 that we are following up. So it's only 1 that we've confirmed. Thank you for having me.
All right, if we were going to, imagine a scenario where it can blow beyond what the figures you have right now, what steps should be taken to prevent this from, blowing out of proportion, you think?
Yeah, a lot of steps have been taken. If I can draw you back, earlier this year, the Nigerian Center for Disease Control and Prevention confirmed some cases of diphtheria in some states in the federation around January, specifically in Kano, Lagos, Osun, and Yobe. And because of the strategic position of FCT and the bordering is being bordering with Nasarawa, Kogi, and Benue State, we can easily come to FCT, as the case may be. So because of this risk assessment of importation from all the states were done, and we are judged to be medium to high. And since then, efforts have been put in place in terms of surveillance to ensure that any case that comes into Abuja will be detected as soon as possible. And that led to the quick response as soon as we got the alert of this case that was confirmed.
And the reports are saying it's 82% of these 798 cases that were seen, the patients were unvaccinated. I'm wondering about the vaccination rates amongst children within Nigeria. If you have any information on that, why it's been so low, especially considering that diphtheria has sparked back up, and what the federal government might intend to do concerning these vaccinations and, of course, sensitization of the population.
If you recall, there has been increase in vaccine hesitancy in our environment and globally. And because of this vaccine hesitancy, both for children and adults, all those diseases that have been controlled with vaccination are rearing its ugly head, especially this diphtheria. And if you know, diphtheria, the diphtheria disease has gone down. It's part of the pentavalent vaccine. Penta in the sense that the pentavalent vaccine is covering 5 diseases, and diphtheria is part of that disease. So there has been a lot of vaccine hesitancy, and unfortunately, some of the children that we are following up, some of them are unimmunized, and they came from the neighboring states.
All right, Doctor. Now, children between age 2 to 14 years are said to be most vulnerable to the disease. Can you give us more insight on that?
Actually, it's expected that before 1 year, any child is supposed to have taken about 3 doses of pentavalent vaccine, which contains diphtheria. And over the years, that has been a low coverage of these vaccines. And if those 2 to 4 years can also are eligible to take booster doses during the immunization, but most of the time they don't go back to take those booster doses. But we are encouraging parents to ensure that their children get vaccinated as when due.
And could you tell us more about diphtheria for those individuals out there who might not be as well versed in the disease? How is it contracted? How contagious is it? What are the symptoms? How is it treated?
Yeah. Okay. Diphtheria is a bacterial disease caused by Corynebacteria diphtheriae. It has several species, but the common one is Corynebacteria diphtheriae. And it can be transmitted from person to person during coughing and sneezing through the droplets. Basic main of prevention is surveillance to detect cases and follow them up and provide care for those cases. And second one is vaccination to ensure that the children, all the immunized children, get vaccinated to contain the outbreak.
Very good, Dr. Ajogwu. Now, still talking about the vaccines, how effective are they? You talked about taking at least like 2 or 3 of such vaccines. Can you tell us more about that?
Over the years, we've all known that vaccine saves life. Every vaccine saves about 3 million lives every year, and vaccine is cost-effective. The vaccine is effective, and I advise that people should get the vaccine. Is effective and cost-effective as well. And the Penta is part of our routine immunization and is given free in all the health facilities.
All right. Looking at over time the treatment of diphtheria in Nigeria, how would you assess its, in terms of effectiveness up to this moment regarding vaccination and treatment as well?
Yeah, for vaccination we have an effective vaccine for diphtheria, and for treatment, for cases of treatment, if available, you could give a diphtheria antitoxin. But if it's not available, you can commence antibiotics, and we have potent antibiotics available that can be given in the health facilities to contain the disease. And the diphtheria antivaccine is available, and the antibiotics, they are all available in the health facilities.
Is Nigeria collaborating with other foreign bodies in order to tackle this disease, or are we keeping it local within the continent?
Yes, the government is collaborating with partners, especially WHO and other partners, and even the response we are carrying out, we are not carrying it in isolation. We are working with WHO, and they are very helpful in this response, and other partners.
All right, if you could shed more light on this, looking at the outbreak, the past outbreak we've been having, where is it most prevalent in Nigeria, and why, you think?
It's like I said, it's usually because of the low immunization coverage and hesitancy in receiving the vaccine. Most of the children that we are following up are children that have not even received a dose of the vaccine. So I think the important thing is to appeal to parents to ensure that their children get vaccinated as I went to.
Well, Dr. Ajogwu, thank you so much for joining us this afternoon, for giving us the update on this disease, and for joining us on Newsday.